Welcome to the Dental School Guide podcast, your ultimate destination for all things dentistry. I'm Dr. Tanner Townsend, your guide through the complex world of dental education. Join us as we uncover the secrets of acing dental school admissions, navigating residency programs, and exploring career opportunities. Please share and enjoy. Real quick, just wanted to make all you pre-dental students out there aware of a resource. If you've ever been worried about getting into dental school or are wanting to get into that school of your dreams, then you definitely want to check out a program called Dental School Guide. In the program, we walk you through how to save money, time, and heartache when applying to dental school. There's so much fluff out there when it comes to resources for getting into school, and we are streamlining all of that. With our comprehensive digital course, expert mentorship, and personalized application review services, you'll have everything you need to stand out to admission committees. Take advantage of this amazing resource that will help you increase your chances of getting into dental school. You'll want to check out dentalschoolguide.com. Check it out. Tanner Townsend, I am your host, and I am here with Dr. Anna Andrada. Dr. Andrada is a DDS endodontic faculty member at the University of Virginia Commonwealth, and she is the pre-doctoral director for the endodontic department. She also sits on the admissions committee at VCU, and she has a master's degree in oral biology. So, Dr. Andrada, welcome. How are you today?
I'm doing really well. Thanks for having me. It's such a pleasure to be here with you, especially having you as one of my best students in my senior select course for endodontics. I'm really pleased to be here today.
Yes, and I'm super glad to be interviewing you. So for those of you that do not know, Dr. Andrada was a faculty member of mine when I was at VCU, and like she said, I took a senior select course where we focused on root canals and doing retreats on simple anteriors along with molar endo as a pre-doctoral student. So have a lot of respect for Dr. Andrada. She has great advice, and so I'm really excited to have the chance to interview her today. So Dr. Andrada, give us a little bit of your background. How did you end up at VCU, and how did you end up as the pre-doctoral director there?
Sure. So I'm originally from Brazil, so that's where I did my dental school, and my first endodontic training was back home. Then we decided, my husband is also a dentist, we decided to move to U.S., so we went up in Boston for our residency. Both of us did residency at Harvard School of Dental Medicine. I did my endodontic training again, and my husband did a periodontic training. I knew I want to teach since back home. So after I finished my residency in endo, I started volunteer at the dental school, and I fell in love for teaching. And so when we moved here, I knew that's what I was looking for. So after my residency, because we couldn't practice in Massachusetts being an international student, we moved to Detroit, University of Detroit Mercy, to have our US CDS. And after that, I stayed as endodontic content expert because they don't have the pre-doc director. They don't have how do I say?
Like a pre-doc endo department kind of thing, or like a pre-doc director
Correct.
for that?
Right.
Gotcha.
They don't have the department, so they don't have a pre-doctoral director position at the school, but I was still in charge of all the pre-doc students. So I got an offer from VCU to come and be the pre-doc director. And again, as I know, that's my passion, and especially staying with the pre-doc students, we accepted that. It was 3 years ago when we moved to Virginia. And Richmond has been an amazing place to live. The school is really great, and we're really happy to be here now.
Well, awesome. And I can totally vouch for her. She is a wizard at teaching pre-doc students how to do endo. So she has saved my butt multiple times, so I appreciate her. All right. So tell us a little bit about VCU. What are some of the things that you love about VCU and like the interactions with the other faculty members along with students, whether that be residents or pre-docs?
Okay. So like I said, this is my fourth dental school that I'm teaching. Even in residency, you have to teach. Every single school is very unique, but I do think VCU is very welcoming. I remember when I came for my interview, multiple faculty and even staff, they were telling me, okay, this is your resting place. When you join VCU, that's where you're going to stay because we have a lot of fun here. We respect each other, and it's a great place to be working at. And I totally agree. Everyone from every single department, we get along really well. I have multiple mentors in several departments, and I'm not afraid to knock at their door and ask for advice. The same with the students. We have a open door policy. Students, and you know that, especially for endo, the sim lab is right across in our endo offices, and the door is always open. Some days, especially if you're practicing a little bit more for mocks or for boards, they come and go, and we are always very happy to do that. The residents help a lot. The endo residents, Dr. Myers, our postdoc director, he's always very welcoming as well. So I think it's a great place to be. I couldn't be happier with my current position. And I really hope that's my resting place. I really hope to grow at school and stay here for a very long time.
Well, I think it's a great place to land. Like you said, that was something that I noticed as a student as well, is super welcoming, super nice. Everyone's really open to talk to you about giving you advice, giving you help, whether it's with post-grad stuff, picking a job, or picking a residency program, or just like, hey, how do I do this single anterior endo? How do I burn off? Things like that. So I feel you there with everyone being open and nice, and having that open door policy is such a wonderful thing there. So what we're going to go into now, Dr. Andrade, we're going to go into your experience as an interviewer for the admissions committee. We'll kind of ask you some questions about that. And then once we're done kind of going through some of those questions, we'll ask you some questions about what do students need to do to be successful? What are the things that you've seen in students that make them the most successful in school?
Perfect.
Okay. So on the admissions side, what are some qualities and attributes you look for in a prospective dental school applicant?
Okay, so I think, everyone that is applying for dental school, you're already very successful in your college, during the college, right? If not, you wouldn't be applying for dental school. You're overachiever for sure, and you have good grades. So I think what we're looking for is someone that is, first of all, has a passion for the profession. It's not an easy profession. We're interacting with patients one-on-one, very closely. Some people, and we know that a lot of people, they don't like to come to the dentist because it's very personal, right? You are like inside their mouth, you're very close to them. So the first thing, you have to have empathy for your patients. You need to know what dentistry is. And I feel a lot of the applicants, they heard of that, but they don't really know what that entails, right? It's not only the procedure, but it's the whole social side of it, or the psychological side of being a dentist. And we are looking for students that are really passionate about that and teachable, coachable. You're very smart. You know how to get good grades, but you still don't know how to be a nice healthcare professional. And that's what we want to teach you, and we're going to be criticizing you day in and day out, and you need to be able to take that. You're not going to get all A's, all good grades, and especially because you came at that level already, and now you have 100 students in your class, someone will be in the top, someone will be in the bottom, but that's okay, because your patient is not going to ask you that once you graduate. They're not going to ask, okay, what rank were you in dental school? They only care if you a good healthcare provider. And I feel like that's what we're looking for. We're looking for someone that is really genuine, looking to do good for your patient.
100% agree. I think that is such a big thing that we notice as we're helping different students apply. Everyone's really good at doing school, and it's really setting apart that you're teachable, coachable, and that you can interact with another human being on a professional level and connect with them. So I love that answer. That's awesome. So how many faculty members are on the admissions committee? Just kind of a rough ballpark. How many do you guys have at VCU that are sitting on that committee helping make the final decisions?
So and I feel like that's very unique as well, because the school was at before, we had a very small admissions committee. Everyone interviews, but the decisions were made mainly by that committee and was a little bit smaller. Here at VCU, if you are an interviewer, you are on the admissions committee. So most of the time we have between 30 and 50 faculty and staff members as well. We don't have only dentists, right? We have faculty members. We have dentists that come, they graduated from VCU or they used to be faculty member, and we bring them to help as well. We have some dentists that represent the VDA, the Virginia Dental Association, so we want to see that as also on the admissions committee. And we also have some interviewers from the research side, from the administrative side. So we want to have a very broad and diverse committee. And I think that's amazing because we all bring different perspective of what we're looking for in a student.
Yeah, that's really cool that there's so many different people that have that perspective that can add to that. So how is the interview structured at VCU? Is it like a 2-on-1? Is it a rotating 1-on-1 so as many faculty and staff can meet that individual? How does that typically work?
So it is, we moved pretty quickly after COVID to in-person again. And I think that's very important because you need to know, it's completely different. You're talking to someone on Zoom, and then you coming and seeing the school, because I can sell you the school all day long, but you need to experience that, right? So the students will come, the applicants will come, they have a whole day plan. They have games, they play Jeopardy games. They have, now we have a whole wall that they can take pictures when they're there. They have a session with students, and the students will talk to them. I know for the Hispanic students applying, we have the HSDA. They do kind of like a lunch or a dinner with them prior. So when they come, they know someone there already. They're comfortable speaking the language, and they know what the school can offer on that sense. And I can say that because I'm the advisor for that club as well. And I think it's amazing. And I do think we have that for other cultures as well. So then when the applicant comes, we have two faculty interviewing that student for half an hour. But besides that, they have a whole presentation throughout the whole day. So it's a whole day deal for them. And everyone enjoys. They carve teeth, they go to the lab, they do some hands-on activities that I think is set us apart as well.
Wow, that's quite a day. I mean, that's a little different than what I had even when I interviewed. I think we were there for 2 days, and they kind of broke it up there. So they've definitely enhanced what they've done. That's really cool. All right. So after that interview, what happens after the interview? Do you guys all meet together and pick applicants at that time? Do you guys reconvene in a couple months after you've interviewed everyone and then pick? How does that process go?
So usually after we interview, we have a very structured rubric that we should be following, right? So we are fair with everybody. Of course, depending how the interview goes, we can ask more questions, less questions. But the interview, and I feel like that's what everyone needs to be aware of. The day of the interview is just for us to know you. We get all your credentials. We know you're very smart. We know why you're applying and why you got accepted for an interview. So that day is just for us to know you 101, just to know if you're going to be a good fit for the class. Because that's also something that we try to do either for dental school, for residency. We need to pick up a class that is going to get well together. You're going to be spending for dental school 4 years together, for residency 2 or 3 years together. We need to have a very cohesive group, right? So that's what we're trying to have a diverse pool of applicants, but at the same time that you're going to get along. So we have that structure rubric. We're going to meet with you. We're going to know a little bit more about yourself. And I think that's what sets you apart as well. Be yourself. I know everything. It's very nervous because that can change your life, right? That's your decision that is going to change your whole future. But don't try to be something that you're not. We can pick up on that very quickly. We are used to talk to the students every day. And we know when you're not really being yourself, when you have reverse answers for us. And we don't want to hear that, right? So we want to see what your aspirations are and what your really desires and the way you're going to act every day. So after that, we do the rubric, we send it over to, of course, we are not supposed to be discussing much between us because we want to see how you're grading each one. And then after that, and if I'm not mistaken, because we have a lot of days that we interview, from August to December. So we don't wait until the very last time because we need to start making decisions and offers because we want you at our school. We don't want you to accept anything else. So we get together many times and then we discuss, why, especially if you have a big difference on grading, then why did you grade this way and I graded the other way? And then everyone gives a little input about that and we kind of vouch for the students that we want to bring in. So that's pretty much how we do it. And we do have also, because we're a state school, we need to have a percentage that are going to be in-state students and a percentage of out-of-state students. So that's something that we need to look into as well.
That's really cool. So do you almost have like a ranking? So you have the rubric where you're grading the different interviewers. Does it eventually go to like a ranking system? Like these are our top Virginia residents we're going for. These are our top out-of-state people we're going for.
Correct. That's how it is. Yes. So then you take into consideration, the grades, the DAT, the GPA, but the interview is a big process of it as well because we want to, like we said, we want to look at a holistic approach, right? You might have had some low GPAs during your undergrad, but then you did a post-bac or you did a master, and now your GPA really increased. So we have lengthy discussions about that sometimes because people are like, oh, no, but the undergrad, it didn't do well. Yeah, but now maybe this individual has matured a little bit and learned how to study a little bit better. So let's take that into consideration because we can't just we all make mistakes, right? And you need to look at, and that's something that we ask on the interview. And if you have something, a life-changing event that happened to you, don't be afraid to disclose that. Because we need to know, okay, I couldn't shadow so many hours because I work full time because I need to help my family. That's amazing, right? And we have those discussions. Oh, this person did not shadow the 100 hours that we're looking for. Yes, because they need to make money to help their family or they have kids at home. So let's be compassionate and see what else we can do to help this person, right?
Yeah, I think that's some really, really good advice because just being honest in that interview, and if you didn't hit everything, just be honest and tell them the reason why. So I think that's really good. So on the rubric, if you care, what are some things that you guys are focusing on in that rubric? Is it, social skills or is it something else?
So it's kind of everything. We're going to look at how the person was talking to us, was behaving during the interview. If you're presenting very professionally or not. So it's like I said, it's a holistic approach of everything. Every single question that we ask, we're gonna kind of grade you on that. But again,
Gotcha.
I feel like it's more the way that you're presenting. Some students, again, we had some that they come chewing gum, or the way you are sitting there, you're like, the whole time like this and looking at us, or like, okay, are you bored? I don't know, and this is something that I'm sure that it's a lot of ways that you can look at how you're going to present yourself in an interview, right?
Yeah.
Another thing that we always tell students afterwards or when they get some feedback from us, listen to the question, answer that question, but don't start talking because sometimes we have half an hour or 1 hour with you. Of course, you want to make a good impression, but we need to ask questions. If I could only ask you one question during that half an hour, that's not really good because I didn't get to know you very well, right? So that's something that, answer a little bit, pause it. If we want to know more, we're going to ask you. At the
Yeah.
same time, don't answer with one word, right? Okay, how, I don't know, what qualities you look in a leader? Oh, you be self-motivated. That's it. And then you stop there. Give an example. Talk about things that really happened to you. Don't, we all know pretty much the questions that every single school is going to ask, especially, why did you choose that school? Why did you choose dentistry? But really answer from your heart and not from someone else that you look online or a chat GPT answer, right? Nowadays.
Yeah.
But we're going to pick up on that. If it's not really your answer, we're going to know that.
Yeah. I think the power of understanding if someone's answer truly comes from the heart, it's something you can really feel. So, no, that is really cool that you are saying that you all feel that when you're interviewing someone. So that kind of leads into this next question. What's some advice that you have for someone that's interviewing at VCU, but just interviewing in general? What are some of the do's and don'ts?
I think like the do's, we discussed very lengthy about that. Be yourself, come with an open mind. Remember that everyone that is there, like we said, they all overachievers, but that's a good group, and you might be accepted into school with the same person. So be nice to everyone. We really take into consideration, and this is more for a specialty program than from dental school, but we do ask the staff and the residents how they felt about that person. Because again, during the interview, you might be saying something that you think we want to hear. And when you are by yourself with other students, with colleagues, with the staff, you're going to be yourself. And we're going to know that as well. We're going to ask feedback. And that's why we do a whole day, because we can pick up those little nuances as well. I know you're nervous. Try to talk to people. Don't be quiet in your own corner, because that's something that we're going to notice too. Can you interact with your colleagues? Can you interact with peers? The don'ts, just don't be snobbish, right?
Don't chew gum in your interview. Don't be snobbish. Don't act like you're better than everyone else.
You need to relax. This is a professional school. We can be friendly, but we are not your friends. You're coming to present yourself. We want to sell you the school, but you want to sell yourself to us as well. So, be presentable. And many, many times, you're kind of talking about something else, and you're using some words and some phrases like, this is not very professional. So be careful about that.
Yeah, I think that's some very sound advice. Okay, so these next group of questions, we're going to kind of move into questions not as much about the interview, but about what do you do once you're accepted or waitlisted or rejected. And then we'll kind of go into the questions about what do you do once you're in. Okay. So if students got accepted to multiple schools, what should be part of their decision process in picking the school that they should go to finally?
So I do think it's very important. You're always going to have a school that is a better fit for you. So I think you need to look and that's why I think it's very important that you interview in person. And because it's not only the school, it's your surroundings, right? Do you see yourself living in Richmond, for example, if you come from out of state? Oh, I've never been in Richmond before. Okay, so come and explore the town a little bit, explore the city, because you're going to be there for 4 years, and in school, it's not going to be your whole life. And we hope that's not the case. We hope that you have, a social life, that you can have a group of people that it's going to be able to help you throughout those 4 years, because they're very intense 4 years, right? So first of all, I think you need to see, can I live in this city? And that's the same when students are asking for advice and which residency they should pick. All of the residents are going to be amazing, but do you see yourself in this place? And I think it's the same for dental school. Then look for what you're looking for in a dental school. Like we have an amazing digital lab, and we are improving that day in and day out. Even the endo side now, we're trying to see, okay, for board preparation, for mock boards, Can we have something that we scan those teeth? We can scan the access opening and you can practice a little bit on your own. Then we don't have to be there for feedback all the time. For crowns, crown prep in the lab, the D1s are starting to scanning their crowns in lab already. So we're moving very fast into that digital side of it. I know OS now, they are training the students to give injections with the VR. So, all of this, technology is here, let's embrace it. So I think that's something that all the new generation is looking for, and we have that in our school for sure. But again, is that something that fits your needs, or you don't want to have much of that? Another thing I feel like is the rotations. Do you really have a lot of clinics that you go for rotations? And we have tons of it, right? We go really outside in rural area, underserved population, that you can have a lot of experience. And I feel like that's very important for you to have. Does the school have a lot of patience for, not only for, I know everyone thinks about requirements, we should not be thinking that way, but, still, do you have, especially for endo, do we have a lot of patients that need endo and are going to be able to afford the cost of endodontic treatment? And we do, because now Medicaid is paying, and I think they were already paying when you were here, right? They paid for the root canal.
Yeah, so this is something for different students to think about. So not every state has a robust Medicaid dental program, and Virginia is one of those that recently did change their parameters on how much they cover. And so, yeah, during my schooling, Virginia Medicaid covered root canal treatment for the most part. So it was really a great opportunity because more people were receiving endodontic treatment, so we got to do more. So that's a question to ask when you're going to different schools of, does Medicaid cover? Because that's a lot of the patients that you'll probably see during dental school.
Or and how many dental schools do you have around, and are the patients really coming to school? So that's something really important to ask, because it might be a great dental school, it might be a great city to live, but if you don't have those experiences in school, how are you going to be very proficient, right? You're going to get your degree, but then how confident are you going to be working on your own when you leave?
Yeah, no, super, super true. Those are all great points. So that's kind of how you can decide if you're accepted to multiple schools. How do you pick the one that you're supposed to go to?
Correct.
Picture the one that you're most comfortable at, and picture the one that aligns with your needs, whether it's digital stuff, whether it's research, whether it's doing external rotations. So make sure you're taking advice of all those different things when you're interviewing.
And another thing too, talk to the students. I think that they are the best advice you can get is from students already into the school. Because everyone, of course, they're going to tell you it's hard. They're going to complain about a lot of things, especially some protocols that you need to follow that you're not really happy about that. But ask them, genuine questions, and they're going to be very honest to you. I feel like that's the best set of people that you can talk to. Take some time to talk to them. And I believe VCU has kind of like a line, like a buddy that you can get in contact, right? And even before the interview, you can get advice, and you can, I think that they call the ambassador program.
Uh-huh.
So you can get in contact with the students, and if you go online into VCU, you can even, just chat with them, just send the questions, and I know they answer pretty quickly too.
Yeah, that's one of the beauties. And then you have your vertical buddy, which we called it. Once, especially, you get that assigned your first year, and that's the point of contact that you have with the upperclassmen. Mm-hmm. Of course, you can communicate with more people than that, but it's really a good resource.
Yes.
So what advice do you have for someone that got waitlisted, Dr. Andrada?
So I think, again, it's very competitive. We only have, up to this point, we only have 72 dental schools in the country. So again, not everybody's going to get in the first time. So if this is something that you really want to do, make sure you improve your application for next time, right? If you're waitlisted, you might still have a chance to be called for a school. You can always contact the admissions office. I'm sure they're gonna give you some advice, but let's say you did not get in this year. Don't be discouraged. If you're in wait list, don't be discouraged. You are already ahead of the curve because you did not get a rejection, right? You might be able to join this class, but if you're not, just keep trying if that's something that you really want. Again, you need to be certain that that's the profession you want to go through. It's not an easy path to be there, but it's a very rewarding profession. So I think, just check yourself, talk to, of course, your family, and see if that's what really you want to do, and then proceed from there.
I love that advice. I think we see this a lot in our coaching, that people really want to know what they can do to get off the wait list. And we give them advice of just some different things that we've seen that have worked. But at the same time, I love your answer of, hey, you need to ask and see what you can do to improve your application so it's not the same result next year. Really making that change from year one of applying to the second year is huge. So I'm glad you said that.
I think it's because, you got waitlisted, or even we didn't call you this year, and you reapplying. Do we have the same chance? Yes, you do, and especially if you improve, right? So take more classes. If the problem was with your GPA or your DAT, take it again. If you didn't have a lot of experience, try to shadow more. Try to do something else that really stands out for next cycle. I feel like if you are shadowing, try to do in different specialties and in a general dental office as well. Because again, you're going to leave the school being a general dentist. So you need to know how that day-to-day life is. Specialty offices are very different, right? So it is good that you have that interaction, but you need to shadow a generalist as well. I think that's very valuable. And not only the dentist, but, try to see what the dental assistants are doing, what the hygienists are doing, or what the front desk is doing, especially if you think in the future you want to have your own office. So you need to know the business side a little bit of it too.
Yeah. I think a diverse shadowing experience is really, really important. Not just having that one doctor that you grew up going to shadowing, but multiple different offices. That way you can kind of get a feel of the lay of the land and specialists. So correct. I think that's excellent.
Another little tip of advice too. We look at letters of recommendation every single time, and just be careful. Not that it's not okay for your family to give you a letter of recommendation if you have someone, but try to stay away from that also, or have someone else, right? Because of course, if it's your uncle, if it's your cousin, they're gonna only say good things about you. You need to have from someone that is not biased towards your behavior or really wants you to be a dentist. So that's something that we really want to see also. Another thing is letters of recommendation. Let's say you did your undergrad and now you're doing a post-bac, but you don't have any letters of recommendation from your post-bac, only from your school in college. So we want to see something more recent as well, right? Shadowing, the same thing. You shadow during the last month before your application, or you did some volunteer work, just that. So in our minds, like, oh, you're doing that just because it's required, or it's really because you want to do good, or you really want to learn something. So be careful about those things.
Yeah, you notice those things. So making sure that you have a long-term, like, extracurricular activities, whether it's like you want to see that you've been working on this for a while, not just months before you came to apply. So I love that. So what are some opportunities at VCU to either for students that want to get into research, but also that are interested in exploring a specialty as a pre-doc? What are opportunities like the Senior Select, for example? What are some different things that VCU has to offer in that capacity?
So every department, we have an amazing research institute at VCU as well, that you can get involved with that if you want. But even with faculty, because at the same time you don't have much time, right? If you want to do research, the schedule is really packed during dental school itself. If you want to do really a research, if you want to have a research background or a research career later on, I think that should be something a little separate. During school, you can always do research with your faculty, either clinical research or even chart review. Every department has someone that is more research oriented, and you can get involved with them. With the residents, they always need help for their thesis, so you can get involved with them also. Now, for specialties, we have the senior selects, and we are getting more and more senior selective classes that we are getting involved now. The new one, the latest new one, is the laser selective course. So it's dental laser in all the specialties. So it's a course itself. I think the oral medicine and oral pathology, I think we had before. Oral medicine is a new one. So we have in every specialty, you have the opportunity to do that. But let's say, because you only can get, that's during the fourth year, you can only get into one selective course, right? But don't be just bound to that one. If you want to explore more, we have specialties in each discipline. We don't have PROS yet, but that's coming. We're going to open a PROS program pretty soon. Go there, shadow, ask questions, ask the residents, what are their experiences are. Because I feel like sometimes you have in your head that you want to specialize, for example, in endo. You're having the endo lab and like, oh, that's the specialty I want to go through. You haven't treated a patient yet, so we don't really know how it is. In the lab, without have the patient component besides it, it's one thing. But when you get to the clinic, it's different. So go shadow, go ask the residents why they decided, why they are doing that specialty, what motivated them. And like I said, everyone is so open to that. So you can have, and you have time for that. So go to all different specialties and talk to people and talk to faculty.
Yep. Open your mouth, go talk to different people, and then go shadow. I think that's the best way to kind of explore if you're interested in something beyond general dentistry. But like Dr. Andrade said, make sure you get experience on a patient doing general dentistry before you make that final decision, because you might find that you love general dentistry and love doing crowns and doing fillings and find that really enjoyable. So make sure that you take the time to explore all the options. Okay, so now we're going to move into some questions about what do you do once you're in dental school? What makes a successful dental student in your eyes and then in the faculty's eyes at VCU? So what have you seen students do that are the most successful at VCU, and what is that specific thing that you notice that is consistent through all those successful students?
So I feel like, of course, being hard worker, but especially during the first year, because I think that's the biggest difference from college towards dental school, right? The schedule is completely different. Again, you're really good in didactics, you know how to study, you have a good schedule, because if not, you wouldn't be successful. But now, besides all of that, you have the lab component. You need to learn the hands-on skills that you never done that in your life. So that's something that will take practice. And don't be discouraged, because you're gonna do, one access opening on anterior tooth, and you're gonna come and show us, no, it's not perfect. I know you want to be perfect on the first time, but that will take time. And I feel like if you are always striving for perfection, that's the goal. So don't be hung out on the grades that you're getting. Every time I do a root canal, I don't think it's perfect. I know I always find something that I can improve for next time. And I feel like that's the most successful you're going to be when you're always criticizing your own work. You're always striving for that perfection. So if the student is really coachable, really teachable on those instances, that's what we're looking for. We have a lot of students that, when we tell them that, they are trying to talk back. Oh, no, but I think, remember for the mock exam when we're doing the ADEX? Oh, no, but I think I did 2 millimeters here. No, don't think that way. Take the faculty advice. We have experiences on those things. And if we are telling you, it's because we want you to succeed, not because we want to be mean, not because we want to be very critical of your. We want to be critical because we want you to improve, not because we want to give you a lower grade. So always ask for help. The more you ask, and we see those students too, they're always coming for more advice. You have a case in the clinic, let's sit down, discuss. What else can I do to improve? Not only thinking about the grade component.
Yeah, I think that is absolutely fantastic advice. If everyone were to follow that advice, I think dental school would be a different place. So making sure you're coachable, making sure you're teachable, and seeking improvement is an excellent point. Okay, any final words of advice, Dr. Andrada, before we wrap this thing up?
I think, surround yourself by good people. Again, you have a very large class. You're not going to get along. Of course, you're going to get along with everybody, but you're not going to have your small group. It's going to be a small group, right? You're going to have more affinity with some people than others. I think it's important that you support each other. You're going to have ups and downs as we have in life all the time. So make sure someone is always on the upside when you're down so they can help you to get up and do it again. You're going to spend so much time in school, and you need to be kind to each other. I think that's the main thing. Don't be judgmental. We all have our own flaws, and we need to help each other to be better. Better person, better provider, and better in life.
Yep, that is excellent. Okay. Well, that is it for today's episode of the Dental School Guide podcast. And Dr. Andrade, we want to just say thank you one more time for coming on, and we appreciate the time. Thank you so much.
Oh, you're very welcome. It was my pleasure. And again, if any of you listening, if you need to contact me, please go to the website, and I'll be happy to answer some questions that you might have.
Awesome. Thank you, Dr. Andrade.
That's all for today's episode of the Dental School Guide podcast. We hope you've gained valuable insights and inspiration to fuel your journey into dentistry. Don't forget to subscribe to our podcast for more expert advice, inside tips, and engaging discussions. If you enjoyed today's episode, please leave us a review. It would mean the world to us. Until next time, keep smiling, keep striving, and remember, your dental dreams are closer than you think. Thanks for tuning in to the Dental School Guide podcast.